Hello professionals, this is Dr. Saad, and as you know, we are recording series lecture for pharmacists who are going to appear for international equivalency exam. So let's resume our topic, that is the remaining part of diabetes mellitus under endocrine system. And point number one of today is about a comparison, that is the comparison between two insulin, that is regular insulin and protamine zinc insulin. If you use these two insulin with the ratio of less than 1.1, it is expected that it would be, or you can say it has the same duration of action. Like this point says that regular insulin and protamine zinc insulin in a ratio of 1:1, in a ratio of 1:1, if you use them in a combination, it would be expected to have a same duration of action. So this was a comparison of regular insulin and protamine insulin. Similarly, there is a problem that is associated with the protamine zinc insulin. It is that it is used in a fewer patient, although it's a long-acting insulin, but it is used in a fewer patient because it provides insulin concentration too low to handle the acute glucose level related to meal. Once person postprandial insulin level, sorry, blood glucose level increases, protamine zinc insulin isn't capable of handling that hyperglycemia because it releases low level of insulin. That is the one reason which is a problem associated with the protamine zinc insulin. And second is that it also generate, or you can say it also increase insulin at night. So there is a two effect associated with it. That number one is the risk of hyperglycemia, especially in post-parental situation, and the risk of hypoglycemia, especially at night. So this, due to this problem, protamine zinc insulin isn't used, or you can say its use is limited with a few patients. Point number three is about the composition of insulin, that is known as lenti-insulin. Lenti-insulin contains 70% of crystalline form, it is also known as ultra-lent, and 30% of amorphous form, which is known as semi-lent. And insulin suspension has duration of action of 18 to 24 hours almost. So main thing was that about the lenti-insulin is it's 70% crystalline, this is known as ultra-lent, and 30% amorphous, that is known as semi-lent. So this was point number three. And point number four is about the stability. As you know that insulin will remain stable at room temperature, during which single vial will be used. Although its stability situation must be kept in mind, must be kept in a control range, but it remains stable, during which a single vial can be used for a short period of time. So overall its temperature has to be maintained to maintain its efficacy. Point number four is about the stability is finished. Point number four is about the hypokalemia that is associated with the insulin. This point says that potassium level drops during glucose utilization. So insulin secretion decrease the potassium level, and it causes hypokalemia. So in the condition when person requires high level of potassium, this situation must be kept in mind. So we will discuss such situation when we will talk about the cardiovascular system. So, but just for information, that insulin is among those drugs which causes hypokalemia. Point number five is about uh, insulin purity. As you know that proinsulin is a factor through which we compare the insulin purity. Insulin interaction. Point number six is about the insulin introduction. Sorry, not interaction. It's about the introduction of insulin. What is the insulin? Insulin is a polypeptide hormone. It increases the entering of glucose, fat, and amino acid, and it doesn't suppress triglyceride formulation, but it supports its formulation. Similarly, it doesn't suppress the lipolysis. So insulin doesn't suppress triglyceride as well as lipolysis, but it also helps in the formulation of triglyceride. And its role is actually to increase the entrance of glucose, fat, and amino acid. And it's an polypeptide hormone. This was just about an introduction of insulin and its composition. Point number seven is about the insulin and glucagon absorb. As you know that insulin and glucagon absorb on IV tubulation. When you administer insulin and glucagon through IV route, it absorbs in IV tubing. Point number eight is about an type of insulin that is known as iletin 2. Iletin 2, maybe I am pronouncing right or wrong. Kindly correct me in comments if you can know about its pronunciation. Iletin, iletin 2, it has two types of insulin, iletin 1 and iletin 2. We will talk about the source of iletin 2. As you know that proinsulin factor of iletin 2 contains less than or equivalent to 10 parts per million. It's a purity factor of this insulin, and it's available as a single species. Either we obtain it from the pork or through from the beef. So dry from these are its source. Iletin 1 is specifically, I think so, we'll talk about in forward points about this, that its source of extraction is pork, but iletin 2 contain is derived from the pancreas of pork or beef. This was all about the iletin 2 source of extraction. Point number 9 is about the interaction that is associated that cause the there are few drugs which causes hypoglycemia. Its examples are propranolol and ibuprofen. So these drugs increase the chances of hypoglycemia. It has an interaction with that. So point number 10 is about the symptom of hyperglycemia. Hyperglycemia, the main prominent symptom is the ketone in the urine as well as acetone odor in the mouth. But in case a person is suffering from hypoglycemia, he don't have this acetone odor in mouth. But in a hyperglycemic case, patient has acetone odor, which is very easily observable. But main thing is that you have to go through a screening processes like HbA1c, glucose monitoring, and then it is further diagnosed. It is one of the symptoms which is visible once person is in a hyperglycemic stage. Point number 11 is about the you can say parental hyperalignment. Parental hyperalignment, it is actually composed of amino acid, protein protein hydrolytase, and glucose, electrolyte, and vitamin. It is known as parental hyperalignment. What's the use of this alignment? It's sudden. It is used basically to avoid the hypoglycemic complications. Sorry, this is the alignment which is introduced in a patient to maintain its blood glucose level, but once it is suddenly discontinued, it causes the risk of hypoglycemia or hyperglycemic complication, because it contains the amino acid, protein, and hydrolyte states, and glucose and electrolytes and vitamins to maintain the blood glucose concentration. Or you can say it can be implicated in case of hypoglycemic condition, and once you discontinue it, it increases the risk or complication associated with hypoglycemia. Point number 10 is about, again, the repetition of previous point, that is about the acetone odor in the mouth will not be visible in a patient who is suffering from hypoglycemia, but it is prominent in a patient of hyperglycemia. Point number 11 is about interaction of thiazide diuretics and its role in a patient who is in its role. Let's discuss it. Thiazide reduces the hyperglycemia, so glucose test is impaired by thiazide. So a person who is suffering from who is a patient of diabetes and is a user of thiazide, then its glucose test is impaired by the use of thiazide because it causes hyperglycemia. It's unimportant in a patient with normal carbohydrate tolerance, but and it intensifies the hyperglycemia in diabetes and pre-diabetic patients. So a person who is diabetic, thiazide diuretic should be used with caution because it can intensify the hyperglycemia and also impair the glucose test. So this is about point number 11, that was about thiazide diuretics. And point number 12 is about the glycogen and its role. Glycogen increases the product level of glucose, and we have two hormones, that is the insulin, which decreases the blood glucose level, and glucagon, sorry, not glycogen, glucagon increases the level of blood glucose. These should be in a balanced stage in a normal person. But how glucagon increases this level? It uses two processes in the liver, that is the glucogenolysis and gluconeogenesis, through which it increases the level of blood glucose level. So if a person is suffering from hypoglycemia and glucose isn't available, then we can also use glucagon through subcutaneous and IV route to manage the patient and to avoid the situation of hypoglycemia. And this was all about glucagon. And point number 13 is about the beta blocker in insulin users. As you know that insulin dependent, if a patient is suffering is a diabetic as well as hypertensive, then atenolol is the best beta blocker because it is selective and hydrophilic. Because of these two properties, a person who is suffering, who is a diabetic as well as hypertensive, atenolol beta blocker is recommended to control the cardiovascular related issues. Point number 14. Point number 14 is about the diabetes mellitus problem. It causes cataract. As you know, that cloudy area in the eye is defined as the cataract, and it causes renal failure and peripheral neuropathy. These are the three complications which is associated with diabetes mellitus. Point number 15 is about the diuresis. As you know that it is one of the symptom of hyperglycemia. Point number 16 is about the erectile dysfunction that is associated with the diabetes, and it's a person who is suffering from diabetes, he is in higher risk of erectile dysfunctioning. Point number 16 is about the purity of insulin. As you know that we talked about proinsulin factor. So currently available all insulin is no more than 25 part per million ppm proinsulin. So it's a purity factor of insulin. So currently available all insulin are not more than 25 ppm proinsulin. Point number 17 is about the blood glucose versus diabetes. As you know that if you draw a graph between the blood glucose of a normal person and diabetic person, in diabetic person it will indicate that a higher peak that occur later, and this peak will, you can say, to this curve decrease more slowly than that of normal patient. That's why that's the more prominent that diabetic patient blood glucose level remains high. That's why we use anti-hyperglycemic drugs or interventions to control that level. This is that which graph is saying. If you draw a graph, its peak of blood glucose level will appear, that will disappear after a longer duration. That's why this is what is which this graph is explaining. So it's not a so technical point. Just keep in your mind that the peak of diabetic patient blood glucose level will, you can say, decrease more slowly. Point number 18 is about the diabetes in spiders. There are some drugs which causes diabetes, which are the, yes, which causes the diabetes in spiders. Its examples are amphotericin B and lithium. So as we have already discussed about diabetes in spiders in the pituitary, when we was talking about the pituitary hormone and ADH and their role and vasopressin. When you just listen to our previous videos, you would get its concept more clearly. But for here, just keep in mind that beta amphotericin B and lithium is one of the causative drugs which causes diabetes in spiders. Point number 19. Point number 19 is about the two drugs that is known as acetohexamide and acetohydroxamide. These drugs have uricosuric potential, and it is used adjunctive therapy in a patient who is suffering from urinary tract interaction. The main effect function of acetohydroxamide is that it decreases the urea to convert into the form of ammonia, and you can say this ammonia resultantly this once this drug decrease the conversion of urea into ammonia, it will increase the alkalinity in chronic UTI patient. So due to this it is effective, it is said as the one of the uricosuric agents. And protamine is a drug. Protamine there are some other factor that is known as protamine due to you can say production of organism such as protamine. So just keep in your mind one thing, that acetohydroxamide and acetohexamide is has a uricosuric potential, as well as their They are hypoglycemic properties. So in a person with diabetes, side by side urinary tract infection, these are one of the two options which is very supportive and effective. Similarly, next point is about the acarbose. As you know that acarbose is a competitive reversible inhibitor of alpha amylase and alpha glucosidase. So what's the role of alpha amylase? Alpha amylase, once it inhibits this alpha amylase, in other words, it will inhibit the digestion of complex polysaccharide. And once it inhibits the alpha glucosidates, it means it inhibits the digestion of oligosaccharides. So it's a role of alpha acarbose, that it's a complex oligosaccharide and it competitive and reversible inhibitor of these two hormones. So this was all about some about diabetes for today. So remaining last section of diabetes will be recorded in the next video, and then we will conclude our topic of endocrine system by looking at its clinical factor. As till from first video till this from the first video till this video, we had been looking at its pharmacological related points, and in next clinical video we'll see how we use drugs in a form of a group to tackle a specific situation according to the standard guidelines. So thank you so much for listening, and if you feel that my this effort is helpful for you, then please subscribe my channel and also guide me if there is need of. I'm sure there would be need of a lot of improvement. Your pointing out my mistakes will actually help me to develop me professionally.